Welcome back to the Deep Dive. Today, we're taking on a topic that, well, it sits right at that tricky intersection of policy, morality, and federal funding.
Absolutely. And our mission here, yours and ours, is really to cut through some of the noise.
Right. We want to give you a clean, structured look at a significant recent action, Executive Order 14182. That's the one signed earlier this year by President Trump.
And it's such a textbook example, isn't it? That political pendulum swing you see in Washington, especially when laws touch on these really deeply held views.
The legal language can definitely get buried under the rhetoric.
Exactly. So we're here to pull together what our sources say, the text of the order, what it reversed, and importantly, how it fits into, gosh, nearly 5 decades of history around these funding restrictions.
Yeah, we dug through quite a bit for this one, the EO text itself, the orders it specifically canceled, and, the background on the Hyde Amendment itself.
So where do we start? The order itself.
Let's jump right in. What does Executive Order 14182 actually do? Hashtag breaking down Executive Order 14182. Okay, so it was signed January 24th, 2025, and the stated purpose, when you read Section 1, it's very direct.
No kidding. It says the policy is to end, and I quote, the forced use of federal taxpayer dollars to fund or promote elective abortion.
And it frames this as reflecting a long-standing consensus that Congress has supposedly upheld since the mid-'70s.
Which is, interesting political framing right there. The EO positions itself as a kind of correction.
Right. It doesn't just state a new policy.
No, it explicitly claims that the previous administration disregarded this established policy. It says they were embedding forced taxpayer funding of elective abortions in a wide variety of federal programs.
So it's presented as cleaning house, bureaucratically speaking.
A bureaucratic purge, essentially, targeting existing funding streams.
Okay, it's clearly political, but let's talk mechanics. How does an executive order actually make this happen immediately? Where's the enforcement power?
Well, that lies in administrative direction. Look at Section 3. The EO points the implementation authority straight at the Director of the Office of Management and Budget, the OMB.
OMB. Okay, why is that so crucial?
Because the OMB basically holds the purse strings for the entire federal government. They control the flow of money.
So what does the OMB actually do then? Just turn off the tap?
Not quite so simple, but close. The order directs the OMB to promulgate guidance. Think of that as translating the president's policy into concrete rules.
Like specific financial instruction.
Exactly. Rules, spending restrictions that every single government agency, every contractor, even accountants have to follow immediately. It ensures the order stops funds flowing to anything deemed inconsistent with Hyde. It makes it real, financially speaking, right away.
Makes sense. So the OMB translates policy into financial reality. But you also mentioned it's designed to be maybe firewall from legal challenges. I saw something in the fine print.
Good catch. Yeah, Section 4, the general provisions, there's that standard but pretty powerful clause.
The one saying the order doesn't create any new right or benefit enforceable in court.
That's the one. It essentially says this order doesn't create something that, say, a private group could sue over, claiming a new right to stop funding or demand funding based on this order.
So it tries to keep the fight political, not judicial.
Precisely. It frames it as an internal directive for the executive branch, aiming to shield the administration from a wave of lawsuits based on the order itself.
Okay.
Hashtag the chain of reversals.
Okay, administratively powerful, legally shielded, but like you said, this action didn't happen in a vacuum. To really get the impact of 14182, we need to look back at what it specifically undid.
Exactly. This is where you really see that policy pendulum swing back hard. Section 2 of EO 14182 explicitly revokes 2 specific executive orders signed by President Biden.
Which ones were those again?
EO 14076 and EO 14079, both signed back in the summer of 2022.
Right after the Dobbs decision came down, the one overturning Roe v. Wade. So what were those Biden EOs trying to achieve?
They were essentially designed as federal responses to Dobbs. Think of them as federal support structures or shields.
Shields against what? Stricter state laws?
Basically, yes. EO 14076, for instance, directed HHS Health and Human Services to work on expanding access to contraceptives. It also involved the Department of Justice, looking at legal support for people traveling across state lines for care.
And the other one, 14079.
That one had a broader aim, securing access to reproductive and other healthcare services. It focused a lot on protecting patient privacy and trying to ensure people could still get care, even with the changing state laws.
Okay, so by revoking those 2 EOs, 14182 does more than just restate the Hyde Amendment's principles.
Much more. It actively dismantled the specific federal mechanisms the previous administration put in place trying to, well, mitigate the impact of Dobbs and stricter state abortion laws.
It strips away those federal protections,
Right.
leaving the landscape governed primarily by the baseline restrictions of Hyde itself at the federal level. And, if you zoom out a bit, this kind of reversal, it's almost clockwork when administrations change.
It really is the definition of that executive branch tug-of-war, isn't it? We saw something similar play out with the Mexico City policy during the first Trump administration.
That's a perfect parallel. That policy, the one banning U.S. foreign aid to international organizations involved with abortion services or advocacy,
It wasn't just reinstated, right? It was expanded.
massively expanded. They applied it across all global health programs, not just family planning. People started calling it the global gag rule.
So a clinic getting U.S. money for, say, HIV prevention.
Suddenly had to certify they wouldn't provide or even refer for abortion services, or risk losing all their U.S. health funding. It shows how these funding restrictions can ripple out, affecting healthcare way beyond just the specific service being targeted. Tag the anchor policy, the Hyde Amendment. That really illustrates the scope. But all this back and forth, these EOs, they all orbit around one central piece of legislation, the Hyde Amendment itself.
The legislative anchor, exactly.
So, just to be clear for everyone listening, the Hyde Amendment, it's that provision passed year after year since 1976 that bars using most federal funds to pay for abortions.
Right. It's the fundamental policy that EO 14182 is essentially trying to enforce strictly across the government. And the exceptions are really crucial to understanding its scope.
Currently, those exceptions allow federal funding only if the woman's life is in danger, or if the pregnancy resulted from rape or incest.
Correct. But those exceptions haven't always been the same. That's a really important historical detail.
Wait, really? I thought the rape and incest exceptions were always part of it?
Nope. For a long time, the exceptions were much narrower. The Supreme Court upheld the Hyde language back in 1980 in Harris v. McRae. But the version that was law from 1981 all the way through 1993,
What was the exception then?
only to save the life of the woman. That was it.
Wow, until 1993.
Yeah. It wasn't until the Clinton administration in 93 that Congress added the exceptions for rape and incest back into the annual appropriations bills where Hyde resides.
So even within this thing called a long-standing consensus, the actual specifics have shifted based on politics.
Absolutely. The core restriction remained, but the edges have definitely been negotiated over time.
Okay, whether it's long-standing or been adjusted, the impact on the ground it's huge. Let's talk scale.
The numbers are staggering. Sources estimate that before Hyde really took effect around 1980, maybe 300,000 abortions were performed each year using federal funds, mostly through Medicaid.
And after Hyde.
That number dropped drastically, down to just a few thousand per year covered by the federal exceptions.
Just think about that shift. 300,000 down to a few thousand. That fundamentally changed the healthcare reality for a huge number of people.
It really did. And that massive drop is why critics argue Hyde disproportionately impacts certain groups. Low-income women, women of color, younger women, immigrants, essentially anyone who relies on federal programs for their health care.
And there's data suggesting that, right? Something about poverty levels.
Yeah, our sources note estimates suggesting around 42% of women seeking abortions live below the federal poverty line. So when federal funding is restricted,
It's not restricting some abstract access. It's restricting very real access for potentially millions who depend on programs like Medicaid.
exactly. And it's not just Medicaid. Think about who gets federal health funding or care. Medicare recipients, Native American women served by the Indian Health Service, U.S. service women and veterans through TRICARE and the VA, families of federal employees, even women in federal prisons.
For all those groups, Hyde significantly limits their abortion coverage, often meaning they have to find the money out of pocket, which many just can't do.
It creates a major barrier.
But it's important to add a layer here. The federal policy isn't the only policy, right? States play a role, too.
That's a crucial counterpoint. While the federal government restricts funding via Hyde, some states actively step in to fill the gap.
How many states do that?
Currently, 17 states use their own state funds, state tax dollars, to cover elective abortions through their state Medicaid programs. They go beyond the federal requirements.
And that's usually because of state laws or state court decisions.
Often, yes, state constitutions might be interpreted differently, or state legislatures pass laws requiring that coverage.
So it creates this incredibly uneven landscape across the country.
Totally uneven. You could have two women, both eligible for Medicaid, living just across a state line from each other. One might have full coverage for abortion services paid by the state. The other might have coverage only under the narrow federal Hyde exceptions.
And AO 14182 essentially just doubles down on reinforcing the federal restrictions within this already fragmented system.
Precisely. It's focused entirely on locking down the federal side of that equation. Hashtag tag tag outro. So if we're summarizing this deep dive, Executive Order 14182 is really the latest turn in this almost 50-year cycle, a cycle of political action, policy reversals, all centered on restricting federal money for elective abortion.
And it specifically rolls back the efforts made by the previous administration to, create some federal buffers after the Roe v. Wade overturn.
Right. It underscores how one executive order often isn't just a standalone thing. It's a move in a much larger, ongoing, and pretty relentless legislative and social battle.
A battle that seems to keep coming back to this specific tool, the funding ban.
Which interestingly brings us to a point about the future of policy fights. Our sources picked up on something recent, an attempt in May 2025 to pass something called the Crenshaw Amendment.
The Crenshaw Amendment, what was that?
It was explicitly called the new Hyde Amendment by proponents. And what it tried to do was prohibit federal funds through programs like Medicaid and CHIP from being used to pay for gender transition procedures.
So taking the exact Hyde model
The federal funding ban.
and applying it to a completely different, very contentious social and medical issue.
Exactly. Now, that specific amendment was ultimately blocked in the Senate on procedural grounds, so it didn't become law. But the attempt itself is significant.
It certainly raises a question. So we'll leave you, the listener, with this thought. Is the Hyde Amendment's model, using federal funding restrictions as a primary lever to shape social policy, becoming or likely to become a more common legislative tactic? Is this template going to be applied to more and more cultural flashpoints in Washington?
Something to definitely keep an eye on as these policy debates continue.